Good morning, Dr. Jaffe. One of our clients writes in and asks if you would please elaborate on the possible negative interactions between vitamin C and iron in terms of redox and chelation. There is vitamin C in the hematin anemia guard to help improve the absorption, but should one avoid taking those higher doses of vitamin C at the same time as iron? So we appreciate you clarifying this for us.
Well, it's a very important question. It goes to the chemistry that a Professor Fenton first reported. It's called the Fenton reaction. And here is a bulletin for my clinical colleagues. The Fenton reaction, which is an autocatalytic damage to vitamin C in the presence of oxidized ferric iron. The Fenton reaction occurs in test tubes. It occurs in the laboratory. It does not occur in people. In fact, the opposite is the case. If you need iron, then vitamin C enhances the uptake of reduced ferrous +2 iron, which is healthy and physiologically managed. And you need ascorbate, antioxidant, to keep the iron reduced in the ferrous helpful form, while most people who lack antioxidants have too much of the harmful ferric +3 iron. Indeed, hemochromatosis and hemosiderosis characterized by excess iron are characterized by excess ferric iron and a deficit of ascorbate. And now an important physiologic point. If you have enough iron, ascorbate does not increase the uptake. Ascorbate only increases the uptake of iron in the presence of need or deficiency. So don't be concerned about doing a C cleanse because it might cause too much iron to come in, and be aware that ferrous +2 iron, your body physiologically regulates through urine, sweat, and stool. It's the ferric iron that only forms when you have antioxidant deficit that causes hemochromatosis and hemosiderosis. And there are monographs of which we have reports and references that show that the Fenton reaction does not happen in people. I know that when it was first talked about at medical meetings of doctors who are involved with getting toxic metals out of people, it got a lot of attention, got a lot of confused conversation. So I'm happy to clarify that Fenton reactions happen only in the test tube, not in the body. And to really be clear about that, a research group in Milan, Italy, using femtosecond, that's 10 to the minus 15 second spectroscopy. Trust them, they did that. But they were looking for the Fenton reaction in biological specimens at that very minute level, and they didn't find it. In fact, one of the points I made, and I still make, is if the Fenton reaction occurred, then the people like Linus Pauling and like people who follow our recommendations, they would have iron overload problems. And actually, they lack hemosiderosis and hemochromatosis, because those conditions exist only when you have a deficit of antioxidants and an excess of harmful ferric iron, which we want you to reduce to the ferrous iron that your body knows how to handle, and benefit from the ascorbate. So let's clarify the confusion. Let's use physiology before pharmacology, and let's let Dr. Fenton have his reaction in the test tube while we enjoy the benefit of both reduced ascorbate and reduced iron in balance in our bodies.